they don't want blockage to be put in their career path, because they think they're older than they actually are.
Careers with the
Precisely. It really affects them psychologically. It's a very debilitating condition.
Okay, I assume this is a man now.
Yes, that's definitely.
What is this?
This looks like a classic androgenetic alopecia. And usually what you find is a tip at the frontal bit of the scalp will be thinning. So if you actually touch that bit at the front, you feel that it's very soft.
Oh, can you pull it out?
Well, it's advisable not to, but you feel the hairs at the front is very soft compared to the hairs at the back. Now, invariably, that soft hair will go.
Okay.
It will disappear, and then the receding will just keep going until it gets to run about the crown, or just after the crown, and then it stops. Yeah.
But some people are totally bald. But we will get to that.
Yes, sure.
I want to ask you, when you treat hair loss,
right,
do you just stop hair loss, or you do something that makes the hair come back?
Yeah, we do both. We do both.
Hair can come back.
Absolutely.
On a bald spot.
Absolutely, absolutely. Well, it depends on what's happening underneath the scalp. The follicles are the most important aspect of the hair. Most people don't see that because all we see is what's on top. But the follicle, if the follicle are still in a viable state, even though they're not that strong, you can treat those follicles, provide them with nutrients to become stronger, and the hairs that come through are much stronger, much thicker. So you could stop the thinning hair. The other things we have are things like the laser cap, treatment.
Okay, that's this.
Yeah,
we're going to
precisely.
come to that very soon.
Okay, so these are all the kind of revolutionary treatment options which are constantly coming on and which are helping in terms of either reversing hair loss or stopping it.
Wow, this is huge. We have to go on a break now. When we come back, we go into treatment options of hair loss, guys and ladies. Unfortunately, he says we can restore our hair; it can grow back.
Absolutely.
So right after the break, we're going into that. Stay with us. Welcome back. You can call in on 01-2206-842. That's 01-2206-842. Treatment options. Let's go into that. I'm going to use this man.
Treatment option. I mean, this is a typical treatment for androgenetic alopecia in both men and women. It's a revolutionary type of treatment. It's based on lasers, the laser technology. It's actually been manufactured by a very reputable US doctor, and basically gives the flexibility to patients to be able to, what we call self-administer their own therapy, as opposed to coming into the clinics for the therapy. Very intrusive, you could wear it.
Let the viewers see what exactly you're calling a laser cap.
Yeah.
This is a laser cap.
So this is the laser cap. And in there, you've got where the lasers come out, the diodes. Is the energy that comes out, and it's the energy that those laser beams send out that actually helps to stimulate the follicle and bring them back to life and
sort
help
of rejuvenate the
follicle. Precisely.
And hair
it's
starts
a
to grow
very
again.
powerful energy that is released by those lights.
So he puts it there.
Correct. Yeah.
Does he have to plug it to anything? Does he have to charge it or something?
There's a battery charger, which once fully charged can be taken, disconnected from the mains. So you've got a belt clip. Yeah. So you could wear this while you're in the car.
How about the ladies?
Okay. Lapel clip then. Okay. You could wear this in the car. It's very safe. There's no side effects. We give very specific instructions in terms of how to use it. And basically we expect seeing serious results literally within a matter of 4 months.
And they can always wear the cap,
and
so nobody knows there's a laser
precisely
cap on.
Absolutely. So it sits very snugly.
Can the ladies wear a scarf?
You can wear a scarf. You could wear it's just anything that makes you feel comfortable without people knowing what you're doing.
Someone's calling in. Hello.
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 All right, great.
That's Sonny.
Good afternoon.
Good afternoon, Sonny. Could we have your question?
Yeah. How long? First of all, let me appreciate what I guess is a doctor, what he's saying. How long would you have suffered hair loss for this treatment to still have worked for you? So, assuming you've been bald for so many years,
that's sweet.
Can you still go on this treatment? Will it work?
Well, I mean, this is just one of many treatment options, by the way. So until we actually see the extent of your hair loss, it will be extremely difficult to say whether this will be an ideal treatment option for you, or perhaps the other types of treatment options out there.
Which we should go into right away.
Precisely. So it very much depends on the extent of your hair loss. This might work for some people, it might not work for some people.
So is this for mild hair loss, major hair loss?
It could be, I say, between mild to, serious. Yeah,
okay.
Yeah.
Now, what are the other things?
Well, the other treatment options are medication. Medication, obviously, is the cheapest treatment option in hair loss treatment. We've got medication like minoxidil, which is a topical medication that we use for thinning hairs to make them grow back stronger. And then we have finasteride, which is a medication that blocks the effects of this hormone I mentioned earlier, DHT, dihydrotestosterone.
Does that have any side effects? I mean,
yes,
something natural is happening in the body and you're blocking it.
Yeah, precisely. It does have side effects. The finasteride drug, obviously, when it was tested in the US, or tried out in the US, it was 2% of the people in the test experienced lower sexual libido or lower sperm count. But the thing is, once the medication stopped, once you stop taking it, all those effects are totally reversed, which is obviously what that's the advice we give all our clients that come in and are prescribed finasteride. Minoxidil, it's a topical medication. It's just a slight irritation that you probably feel, itchiness of the scalp, and perhaps white flakes.
Hello, it looks like we're having a call. Hello?
Hello?
Your name?
Good afternoon.
Hello?
My name is Naya.
Naya, please, let's have your question.
Sorry?
Go on, we can hear you.
The question is, I started losing my hair like 3-4 years ago. I used to have a full, quite lovely hair. So I started losing it like 4 years ago. I cut the hair to grow again. I cut it like really low. It grew and it started growing the same way. I cut it a second time and it still grew the same way. Like patches where you don't have hair.
Okay.
But now I have cut it like clean shave. It is shaven. Very shaven. I thought that, I don't know. I am tired.
Thank you very much, Ifunanya. I think Ifunanya would like to have her hair back.
Right.
Can she get her hair back?
Well,
she has patches where the hair doesn't grow anymore.
Doesn't grow anymore. The question I'll probably ask her would be whether she's had, used chemical relaxers. That'll be the first thing. It could also be the shape of the hair loss itself, to see whether it's alopecia areata. So those are the kind of things that we'll typically pick up when she comes in for consultation.
Okay.
Yeah.
So let's go to the other types.
So the other types, and perhaps the most popular of our treatment option, is what we call the microscalp pigmentation, which is usually, though not exclusively, a treatment for men. Basically, it's an aesthetic procedure. So we would effectively implant ink pigment into the bald areas of the scalp to recreate the appearance of hair. So it's a kind of aesthetic, kind of cosmetic procedure, which obviously gives the hairline, which is usually the first thing that goes to baldness. That's what frames the face.
Okay. So he doesn't really have his hair back.
He doesn't have his hair back.
But he has the
appearance. Something like my hairstyle. In fact, I had scalp pigmentation done because I'm bald.
I was wondering whether I should ask you. You had pigmentation done.
I did.
It doesn't show.
Well, precisely.
I don't even know where you had it.
Yes. Okay. If I could show you, all this part of my scalp is bald. I'm balding up to there.
It looks like you have a clean shave there.
Precisely.
There's some little hair.
Precisely.
So this is what you can do to mostly men.
Mostly men.
We're getting a phone call. Hello. George from Port Harcourt, please.
Yeah.
Your question. Good afternoon, George.
Okay.
Can we have your question? Hello, George.
Yeah. Afternoon.
Good afternoon.
I'm Reverend George from Port Harcourt. I thank God for your program. I've not seen for a long time, but I thank God I've seen today. Yeah, it's a program I'm going through. People, and then they will bring all this problem with her, and I have a lady, a daughter, just about 15 years, and they have been passing through this hair. So I started, and around the two, all of them will open their hair and show me and ask me to pray and anoint them. So I was surprised that there are doctors that can hear this. So this program is a very good one to this problem. So what can we advise them when they have such problems?
Did you get that?
I didn't quite get it. It's something to do with a 15-year-old girl. That's about the only.
That's what I want to ask.
Is she losing her hair, this girl, this young lady?
The one of 16 years is losing her hair.
Okay.
The one of 16 is losing her hair. And the other one is about, that is something years too, also the same problem.
Okay. Okay. Now, as the 15-year-old, has she been using any chemical relaxers? Hello? The 15-year-old girl, was she using relaxers, chemical relaxers?
Well, I don't, because she's staying abroad. They are using the chemical relaxers. I don't know, she's staying abroad, but it's giving a lot of problems to the parents, and they are all starting to.
Okay, thank you very much. Let's take it this way. If she were using chemical relaxers, would you advise her to stop?
Yes, I would. Yes, I would.
So you would advise that she have natural hair?
I would advise she has natural hair for a while.
How about in the places where there's no hair?
Well, at the moment, we can actually treat that with minoxidil, which is one of the topical medication I mentioned earlier. Hopefully, there are viable follicles there, for us to work with. So yes, she can have her hair back, even in those areas.
So you could use a cap for her?
Probably not a cap. I think, obviously the cap is quite expensive, but the topical medication, minoxidil, would probably be.
Is there provision for actually making hair grow out again without a cap?
Of course. I mean, you've got hair transplants, which is the...
They do transplant
Yes,
hair.
Precisely, which is the most expensive type of hair loss.
Now, when the hair is transplanted, does it grow by itself?
Of course, because what it is, it's your own hair being plucked or taken from one part of your scalp and being implanted in another part where you're bald.
So it grows naturally?
It grows naturally, and it's a natural feel, it's, just your...
And the hair fills out?
It fills that way, yeah, absolutely.
That's just marvelous. Yeah. But there's this final question I want to ask you.
Okay.
Because I'm being told that we're running out of time.
Okay.
Women with processed hair, they perm their hair.
Okay.
Would they have to lose all that permed hair to go through this treatment? Or can you transplant their hair and,
well, it's
to make it look natural?
It's not the processed hair that we're transplanting, it's the natural hair. So the hair will be cut down anyway to the base level where there's no straightened hair. And it's those hair that are then pulled out to then transplant it. So it's not the straightened hair, it's not the processed hair that's transplanted.
It's the natural hair.
It's the natural hair.
But there's hope.
There's definitely hope.
They can get their hair back.
Absolutely.
There are a couple of questions I would have loved to ask you, but we're out of time.
Okay.
Thanks so much for coming. This has been so
Thank you for inviting me, Mary. That's very kind of you.
Thank you so much.
Thank you.
Thanks for being with us. Thanks for all the calls, and thanks for letting us into your home. Have a pleasant day. I am Mary Alale Yusuf.